Greetings again. Okay, so we're going to continue with the topic of the hand, and we've already looked at the functional importance of the hand. We've looked at part of the gross anatomy, where we looked at the bones and the joints of the hand, and now we're going to move on to the muscles of the hand. So the muscles of the hand are best remembered by considering them as separate groups. Now, just so that we're clear, this is how I divide them to make them easier to understand. Okay, if you guys use a reference that classifies them in a different way that is easier for you to understand, that's totally fine. As long as you just kind of get the information in the end. Okay, so you've got muscles of the hand that are specific to the thumb. Basically, this means that these are a set of muscles whose entire action is related to moving the thumb. And these muscles are called the thenar muscles. And when you look at the palm of your hand, you'll kind of notice that there's this elevation in the region of your thumb, and this is called the thenar eminence. Okay, so that's where the thenar muscles are found. Okay, you've got a set of muscles that is specific to the little finger. Okay, and so similarly, these muscles are responsible for moving the little finger, and these are called the hypothenar muscles, and they also form that little elevation that's found on the side of your hand, and that's called the hypothenar eminence. And then the last group is the mid-palmar muscles, and these are just the muscles that are found in the middle of the palm, in between the sets that we just previously mentioned. So in between the thenar and the hypothenar eminence, anything in the middle there, those are called the mid-palmar muscles. Okay, so let's look at the thenar muscles. Generally, for the thenar and the hypothenar muscles, okay, you want to think of them in terms of the three things that they do. Okay, you're going to have one of them that is responsible for abducting the finger, so basically moving it away from the midline. You're going to have one muscle that is responsible for flexing the digit, okay? And you're going to have one muscle that's responsible for for doing a motion that we call opposition, which is basically when you bring your thumb across your palm and then towards your little finger. So you're kind of bringing the tip of the two together. So the tip of your thumb with the tip of your little finger. Okay, so that's called opposition. Okay, is يعني عادة احنا we explain it بنقول حركة التسبيح. Okay, where you bring your thumb and then you just kind of count along the divisions of your finger. Okay, so what you do with these three muscles is that you give them the name of their action, and then you add the term pollicis brevis. Okay, pollicis is a term that refers to anything that is related to the thumb, and brevis basically means a small muscle. Okay, so what you're gonna have is you're gonna have one muscle that runs let's just say superficially. Okay, so basically if you dissect the palm and you remove the layers, the first muscle that you're going to find is what we call the abductor pollicis brevis. Okay, and then underneath those two, underneath the abductor pollicis brevis, you're going to have two muscles. One of them is going to be found medially. The other one is going to be located on the lateral side. Okay, so the one that's on the medial side, so nearer to the palm, okay, that's going to be the flexor pollicis brevis. Okay, so that's the one that causes flexion. And then the opponent's pollicis, the one that causes opposition, is going to be found on the lateral side. So those are the three muscles that give me the thenar eminence. They are three muscles that are concerned specifically with moving the thumb, either to cause abduction, flexion, or opposition. Okay, and then you're going to take that same rule and then you're just going to apply it to the hypothenar muscles. Okay, all right, so you're going to have the same idea. Okay, you're going to have a flexor, an abductor, and an opponents. Okay, the only thing you're going to do here is you're going to change the name from pollicis, which is related to the thumb, and you're going to call it digiti minimi, or some people pronounce it digiti minimi. Okay, whichever one works for you. Okay, so you're going to have, sorry, two superficial muscles here. Okay, one of them is medial, one of them is lateral. Okay, and then underneath the two, you're going to find the last one. Okay, so the arrangement on the hypothenar side is a little bit different than it is on the thenar side. Okay, so the medial one here is going to be called the flexor digiti minimi brevis. Okay, so that's the one that's responsible for flexion. The one that's found on the outside, okay, or sorry, along the side of the hand, okay, that's going to be the abductor digiti minimi. And then you have to move those two to the side, so you're going to have to look deep under these two to find the opponent's digiti minimi. Okay, so those are the three muscles that give you the hypothenar eminence, okay, and they are the hypothenar muscles, and together all three of them work specifically on the little finger. Okay, now we've got another set of muscles, and these are part of the mid-palmar muscles. So these are going to be found in the middle of the palm. These are called the lumbricals. Now, if you remember when you took the muscles of the forearm, specifically the muscles of the anterior compartment, okay, you remember we had the flexor digitorum superficialis and the flexor digitorum profundus, and how their tendons kind of passed through the entire hand in order to reach their insertion in the fingers, correct? So that means that along the palm of the hand, I'm going to have what we call the long flexor tendons, okay? And those are just the tendons of the muscles that are found in the forearm. So the belly of the muscle is found in the forearm, but the tendon of the muscle is going to be found in the hand, okay? Now the thing about the lumbricals is that they take their origin from the long flexor tendons, okay? So these are one of the muscles that don't actually originate from bone, they originate from a tendon, okay? So you can see here that this is one of the flexor tendons, and then this is one muscle that's attached to it. And then you've got another long flexor tendon here with another muscle coming out of it, and that applies to all the other lumbrical muscles. There's 4 of them, okay? And each one takes its origin from the flexor tendons, and then what they do is they pass in order to be attached to the base of the proximal phalanx, all right? So what these muscles do is they cause flexion of the metacarpophalangeal joint. So you can see in this picture here, this is the metacarpophalangeal joint, and you can see how it's flexed in order to kind of just pull the fingers a little bit closer to the palm. All right. So the lumbricals are 4 muscles found in the mid-palmar region that take their origin from the long flexor tendons, attached to the base of the proximal phalanx, and they work on the metacarpophalangeal joints. All right. The second set of mid-palmar muscles are what we call the interossei. Okay. Now, you guys know that ossei or osseous refers to bones. Okay. And interossei means in between bones. So you can kind of guess from that name is that these muscles are located in between the bones of the hand. Specifically, they're found in between the metacarpal bones. All right. Now, the interossei muscles are 2 sets depending on the side of the hand that they are found on. Okay. If they are found on the dorsal side, so basically remember the side of the hand that had thin skin, okay, these are going to be called the dorsal interossei, okay? And if they are found on the palmar side of the hand, so the anterior surface of the hand, they're going to be called the palmar interossei. So you've got 2 sets, one on either side of the hand. You've got the dorsal interossei and you've got the palmar interossei. Now, the way that the interosseous muscles work, depending on their attachment, is that they act on all the fingers except the middle finger, okay, or basically the 3rd finger from the lateral side, okay? So they work on all the fingers except the 3rd one, Okay, so you'll kind of notice here how the palmar interossei don't even actually attach to the middle finger, okay? And then with the dorsal interossei, it's got one on either side, so it kind of stabilizes them. Kind of stabilizes it in its position. So the idea is that the middle finger kind of acts as what we call the axis of the fingers, all right? Meaning that if I want to move my fingers either towards the midline or away, and you guys can actually try this on yourselves now, okay? If you pull your fingers to the middle, notice how your middle finger doesn't move, but your index finger, your ring finger, and your little finger do, okay? So if you kind of pull your fingers away and pull them back in together, okay, notice how the middle finger doesn't move, all right? So in this picture here, okay, this is just kind of indicating what I just meant, all right? The middle finger is considered as the axis of the hand, okay? And these three fingers, when they're moving, they either move towards this middle finger or away from it, okay? Now, if they're moving towards the middle finger, we're going to call that adduction with a double D, okay? And if they're moving away from it, we're going to call it abduction, okay? Now, to move the fingers towards the middle one, so adduction with a double D, okay, that is a function of the palmar interossei. So the palmar interossei bring the other three fingers closer to the midline, whereas the dorsal interossei are responsible for abduction, so basically moving the fingers away from each other, okay? And you can remember that with the mnemonic PAD or dab, where the palmar interossei are responsible for adduction and the dorsal interossei are responsible for abduction. Okay, so in summary, you've got the thenar muscles, which are the muscles that are related to the thumb. You've got the flexor pollicis brevis, the abductor pollicis, and the opponens pollicis. Those three form the thenar eminence. There's an extra muscle that works on the thumb, even though it's not considered part of the thenar eminence because it doesn't form that elevation, and it's called the adductor pollicis, and this is responsible for adduction of the thumb. So even though the adductor pollicis works on the thumb, it doesn't actually form part of the thenar eminence. You've got the muscles of the hypothenar region, or the hypothenar muscles, the ones that work on the little finger. You had the flexor digiti minimi, the abductor digiti minimi, and the opponens digiti minimi. All right, and then the others, which were the ones that are found in the mid-palmar region. Okay, you had the lumbricals, and remember those were the ones that came from the long flexor tendons. You had the interossei, which were palmar and dorsal. And there's an extra one that we didn't talk about. It's called the palmaris brevis. This is a really small muscle that just kind of helps with strengthening the palmar region. Okay, so to kind of just bring that all together, because I know we mentioned a lot of muscles and a lot of different movements and things. Okay, so we're gonna just watch a little quick video here. Okay, and hopefully this video will make the hand movements a little bit clearer for you. Okay, so what it's going to do is it's going to show you each action, and it's going to give you a little label at the bottom there. Okay, so it's just showing you the movements at the wrist. You've got adduction and abduction. Okay, so that's flexion and extension. Okay, so abduction is just basically spreading the fingers further away from each other, and adduction is bringing them closer together. Okay, and دي حركة التسبيح اللي قلت لكم عليها اللي هي opposition. Okay, that's just throwing you thumb abduction. Okay, I'm gonna stop this here. Okay, normally in the lecture I let them do the quiz, but again, I don't want to make this lecture too long for you, so hopefully we can do that another time. Okay. All right. Now, just a quick reminder, if you guys usually at this point in the lecture, I have a picture of the tables that are found in Richard S. Snell's Clinical Anatomy. Basically, what the tables do is they summarize the different attachments of the muscles, their nerve supply, and their action. And I don't make the students like read the full table in the lecture, but I just have it up at this point. And then you are required to go and read it and check the different attachments and so forth. So I didn't want to put it here because the text is a little small, so it wouldn't have been clear for you, but please make sure that you go check these tables just so that you know the different points of attachment and their nerve supply and so forth. Okay, and then of course, obviously, which muscles cause which action. Okay, now we're going to move on to something that just kind of focuses on the whole strengthening the palm and making it functionally able to grip objects easily, which is called the palmar aponeurosis. Okay, now if you're dissecting the hand, and specifically dissecting the palm, okay, once you remove the skin, you're gonna find, and then whatever underlying tissue there is, okay, you're gonna find that in the center of the palm, okay, there is a thickening of fascia that is triangular in shape, and this triangle is usually inverted, such that the base of the triangle is closer to the fingers, and then the apex of the triangle is down here at the wrist, okay? Now this strengthened fascia, okay, is called the palmar fascia or the palmar aponeurosis. So the palmar aponeurosis is a triangular shaped thickening of the deep fascia of the palm of the hand. It serves to stabilize the tendons and muscles of the hand during movement. So basically, whenever you move your hand, whether it's flexing your fingers or extending them or whatever, instead of having your tendons and muscles, kind of jumping out at you at every movement, okay, the palmar aponeurosis just kind of holds them in place so that you can move your hand easily without having anything kind of impeding or interrupting your movement. And the other importance of the palmar aponeurosis is that it attaches the skin of the palm to the underlying structure. So it basically acts as like this glue between the skin and the underlying structures. And that's actually why you have the lines across your palm, which are called the creases. Those are the points of attachment between the skin and the fascia. Okay, so that wraps up the second part of this lecture, which was just basically about the muscles, movements, and of the hand and the palmar aponeurosis. We're halfway down. We've got 2 more videos to go, so I will see you guys in the next one.